A strong woman with a zest for life and a passion for teaching.
Michelle's definitely outgoing, very funny, very family oriented, just a lover of life really.
But after planning to undergo what should have been a simple nose job whilst living in Turkey, this is Michelle now.
Since then, Michelle is now in a permanent vegetative state, so she cannot talk, she cannot sit up, she can't do anything for herself, she needs 24-hour care. It's been very, very hard. It's been hard for her daughter, it's been hard for my mum.
Made harder by conflicting reports. First they were told she hadn't been operated on and had suffered a cardiac arrest after a general anaesthetic, but incisions to Michelle's body suggest otherwise.
Nobody actually knows what's happened apart from Michelle and the surgeons. So, yeah, I'd like to be able to get closure on the situation.
They're suing for more information. Burcu is a Turkish lawyer based in the UK and says their case is strong.
There was nothing that would explain the situation she's in right now unless something went really wrong.
Each year, millions travel to Turkey to soak up the sun, sea and culture. But some book a different type of package deal, one which includes flights, accommodation and cheap surgery. And whilst complications can happen everywhere, flying straight after a procedure increases risks, and these package deal providers are not covered under UK law. This is why Burcu turns down almost 90% of these cases, because action costs more than surgery itself, and many don't have a legal leg to stand on.
Most of the time, these people are being asked sign these big waivers that are totally more than a regular waiver and mostly in Turkish, and then they simply give away all their rights.
Like Michelle Heath, after losing 10 stone in weight, she wanted rid of the loose skin. Paying for a package deal in Turkey, she went for a leg and back lift and returned with open wounds and infection.
Bruising, swelling, skin grafting, leaking.
She says the NHS saved her life.
My legs were necrotic. They needed debridement, and then obviously restitched up and whatever. And then a week later, the back had opened, so I needed major skin grafts. So the hospital, obviously, there was 4 weeks stay in the Ulster Hospital and 2 surgeries. It's just so uncomfortable. I used to train 5 days a week, and I'm back to the gym, but I'm not doing what I want to do, and I don't know if I'll ever be able to, because I can't stretch.
Michelle's story is one of thousands echoed on Facebook groups like this. And as the number of Brits travelling to Turkey increases, so does the number of those returning with major complications. An association of plastic surgeons says it's the NHS that pays the price for cheap surgery. It costs an estimated £15,000 per patient to fix complications. It's calling for mandatory insurance.
This would be an additional cost. Also, it would protect the NHS in that if they do choose to go abroad, should they then end up with difficulties or complications and require NHS treatment, that those costs are covered, and also it doesn't disadvantage those people who have been on waiting lists for now many, many months for their surgery and their procedures.
Barb says insurance should be mandatory to push up costs and make cheap package deals less appealing, to stop both patients and the NHS having to pay the price for botched surgeries. Shimon Freeman-Powell, Sky News.